Nellie, are there any housekeeping items or am I good to go?
No, you should be good to start. Thank you.
Okay, great. Hi, everyone. Thanks for joining. Tonight for Headache School, we'll be going over headache and herbal supplements. So a little bit of an overview of herbal supplements in general, and specifically some that have been studied in headache. So specifically what we'll go over in the slides and then have some time to chat afterward is kind of the difference between herbal supplements versus over-the-counter medications versus prescription medications. Where does the distinction lie? Things to look at when considering herbal supplements, things that I look at as a pharmacist when patients are asking about herbal supplements, and then some common supplements that are used in headache. So first, like I mentioned, we'll go over the difference between RX, so prescription, OTC or over-the-counter products, and herbal supplements. So what is a prescription medicine? Per the Food and Drug Administration, prescription medication is a pharmaceutical drug that requires provider oversight. And that's why you need it dispensed via prescription to know that you have oversight by a provider who wrote that prescription. There is potential for misuse with prescription medications. That's really a distinction that makes the prescription necessary. There's either drug abuse potential, they have actions such that if you were to take it or to recommend it, you would be practicing medicine without a license and without proper education. These products, so prescription medications, are the products themselves, and advertising is regulated both by the Food and Drug Administration. They're required to go through a very high level approval process to provide proof of both efficacy, so how well it works, and safety, so how safe it is, and if there are safety risks, what are those safety risks before we give it to the public, before it can be marketed. This is the highest level of regulation for any of the products that we'll talk about: prescriptions, over-the-counter products, and supplements. Interestingly, the United States is just one of a couple countries, the US and I believe Australia might be the only big countries where prescription manufacturers can actually directly market their products to patients, to the consumer. So all the commercials that you see for prescription drugs, you wouldn't see those if you were in a different country. And they do require a level of oversight to make sure that no false claims or inappropriate marketing is happening. So versus a prescription, what's the difference between that and an over-the-counter medicine? These are sold to us directly without a prescription. We don't need a doctor's order for it. These are used to treat conditions that do not need the care of a healthcare professional, i.e. they're appropriate for self-medicating. The products are still regulated by the Food and Drug Administration. They do contain an approved drug facts labeling, which you'll see on any product that you get over the counter. The advertising, though, is no longer with the FDA. It's now with the Federal Trade Commission, which does advertising for a lot of different areas. Examples of an over-the-counter medication are any items with a therapeutic effect. So sunscreens are over-the-counter medications. Certain anti-dandruff shampoos are considered an over-the-counter medication because they have a specified level of active ingredient. Creams and lotions, so anti-itch creams, lotions for anti-itch are also over-the-counter medications. Lower doses of prescription medications can also be available over the counter. So something like ibuprofen in its brand name Advil is available over the counter as a 200 milligram tablet, but you can also get a prescription medication ibuprofen in a 600 or an 800 milligram tablet. But the distinction there is that you really should be monitored by a provider to be taking an 800 milligram dose. Because of risks to the stomach, risks to people with certain underlying medical conditions, versus if you were to take just 200 to 400 milligrams of ibuprofen over the counter. That's generally safe as long as it's used infrequently. Other medications you may have seen as a prescription in previous years, but are now available over the counter. Like I know that Claritin, when I was a child, was available with a prescription, but now it's available over the counter, along with a lot of other products like Prilosec. The newest one is like a Voltaren gel, which used to be a prescription, but is now over the counter. If the manufacturer provides sufficient data that the medication is now appropriate for self-care, they can be downgraded to just an over-the-counter medication. So those are regulated by the FDA. A dietary supplement, though, does not have FDA regulation. A dietary supplement is defined as a product that's taken by mouth that is intended to supplement the diet, and that contains one or more dietary ingredients. And these kind of run the gambit: vitamins, minerals, herbs or other botanicals, amino acids, or other substances such as enzymes. So I know I use the word herbal supplement, but I really should be using the term dietary supplement, so I apologize. Supplements are not intended to treat, diagnose, cure, or alleviate the symptoms of diseases. They're just meant to supplement the diet. These are the least regulated of products. They're not approved by the FDA. There's some oversight only once the product is on the market. So anyone can develop a dietary supplement, anyone can release a dietary supplement, which makes it kind of dangerous at times. And we'll go over some of the more startling cases of that. So with regard to supplements, our mantra is really to be safe and be informed with use of supplements. And this is just an interesting quote, and it's really true. The more than $30 billion supplement industry is largely regulated by the honor system and not the FDA. So these supplements are huge. They're big money makers. So there's a lot of incentive for people to release supplements and to advertise supplements. But like I mentioned, there's no oversight of the products until they are released. And beyond that, there's really no oversight until it comes to the attention of these organizations. So as far as regulations, these supplements must be labeled as such. They must be labeled a dietary supplement, an herbal supplement, or some sort of similar wording to that. They must include a supplement facts label listing their ingredients. Notice it's not going to say drug facts, it's just going to say supplement facts, but it still has to have the ingredients on there. It should be a huge red flag if there's no ingredients listed. The dietary supplements also must report serious adverse events, but it's unclear how often that's happening. It has to come, from the patient first. But if the patient tells the manufacturer of the dietary supplement, they are regulated. They have to report that back. They don't have to, though, prove that their product is safe before marketing, and they don't have to prove that claims regarding the product are accurate or truthful before marketing. So whereas with prescription medications, they have to prove that they're both efficacious, so that they work, that they do what they're supposed to, as well as that they have a tolerable level of safety and we understand the risks. Dietary supplements don't have to do either of those things. Following introduction to the market, so once it's already available to consumers, the FDA does monitor those safety events that are reported to them. And as resources permit, and there's not a ton of resources, unfortunately, for this, they review product labeling and information to make sure that they're not making false claims and such. The Federal Trade Commission monitors advertising, again, as resources permit. So these are some of the things where dietary supplements can go wrong. On the left side, we have two examples of dietary supplements that have false claims or claims that are not backed up. So Prevagen is a product that is still pretty popular for boosting memory, and it There was back in 2017, and so their advertising has changed a bit since then, but they were accused of misleading customers with extravagant claims. And their herbal supplement Airborne, which is most often higher doses of vitamin C and zinc, sometimes for colds, they had to pay almost $25 million in a lawsuit over false claims of their action. And on the right side is kind of more dangerous examples of what can happen when a dietary supplement is left unregulated. Hydroxycut, which is still available now in a different form, really has a storied past. Hydroxycut was originally released with a medication in it called ephedra, and about 155 people died before the FDA was able to ban the product. So a lot of harm was done due to the presence of ephedra in that product. A lot of heart attacks happened. And so it came off the market. That was back in 2004. It came back on the market in 2005. It no longer had the ephedra in it, but it did have ingredients that were linked to liver damage. And so the new ingredients were also not safe. And there was a lot of cases of serious issues, and there was another death associated with Hydroxycut. And Hydroxycut was recalled. So it wasn't banned this time, but it was recalled from the market in 2009, again, due to safety issues and another person dying from using this unregulated supplement. Hydroxycut is back on the market again, and mostly contains like caffeine and green tea at this point. So it is safer. However, you will still find case reports of usually when people take too much, but you can find case reports of Hydroxycut still causing some injury in patients. The other thing we run into is when someone, a dietary supplement manufacturer, claims that this is a supplement, but actually like sneaks in a little bit of a prescription medication in there, which is obviously illegal. And so that happens a lot with natural male enhancement products. A lot of them will actually contain sildenafil, brand name Viagra, or a different prescription medication used to treat erectile dysfunction, but be sold sold as a dietary supplement, and that's illegal. You do need to be monitoring people on erectile dysfunction meds due to issues. And so it's really important that these dietary supplements rather, stay away from people. So there is an optional certification that dietary supplements can do to kind of make them more reputable in the industry. However, this is totally optional because it's not regulated. They're not forced to. They don't have to prove efficacy or even that what's on their label is actually what's inside the bottle. But you can, if you want to be reputable, go through one of these certification processes. They will not validate any claims that you have about your product. They will just make sure that what is on the label matches what's, what are the components of the tablet. So if the tablet says that they have B12 at 1,000 micrograms, these companies will check to make sure that the tablet actually contains that, nothing more, nothing less, and no sort of extra ingredients. Like I mentioned, there's no real incentive for dietary supplement manufacturers to do this. It costs a lot and people will generally buy their product without it. So many supplements do not seek certification, but we do recommend using supplements with certification whenever possible. A 2015 study showed that only 21% of products had the ingredients on their labels. So that's why it's really important to us that when possible, you try to use a certified product, because that means 80% of dietary supplements out there don't contain what they said that they contain. And that's pretty scary. Some safety issues that can happen with dietary supplements beyond just the you don't really know what's in the pill sometimes, are that there can be drug interactions, just like with any prescription or over-the-counter product, like something like St. John's wort, which is commonly used for depression. It has good data to support its use for depression, but it can interfere significantly with levels of oral contraceptives, so birth control, immunosuppressants, certain cancer drugs, and many others. It has tons of drug interactions. So if someone just picks that up over the counter, as a dietary supplement off the shelf and doesn't check with their provider first, they could really be putting at risk the prescription medications, potentially like cancer therapy, that they're on. These dietary supplements are not without adverse effects. And so for an example, in patients who may have an elevated risk for bleeding, so say someone's on a blood thinner for some reason, if they take ginkgo, it can cause spontaneous bleeding and really make that a really bad situation. And one that's really relevant to this group is butterbur, which we'll talk about in a little bit. It is sometimes used for migraine prevention, but if a certain component is not removed from the product, it can be toxic to the liver. So making sure that you're getting a reputable manufacturer for your supplement is really important. So in addition to safety, we try to look at efficacy wherever possible. It can be very difficult to distinguish between the marketing of a product, even with prescription medications, honestly, versus the facts about the product. With regard to dietary supplements, because they don't have to perform studies, the studies don't have the same rigor as a study for a prescription medication. The studies are often conducted by the manufacturer that's trying to sell it to you, and without the kind of the pillars in place to make sure that it's sound data. And they also usually have very few patients. You usually need a number of patients to be what's called powered to determine significance of your results. But these studies often have very few patients because it's cheaper to have fewer patients. And so they aren't scientifically sound, and it's very hard to draw good conclusions from the data. Like I mentioned, with no requirement to prove efficacy, the manufacturers don't have motivation to conduct structured, rigorous research. They're just, it's almost like it's a marketing ploy, the research that's done sometimes. We do have a lot of traditional herbs that have been around for centuries, and they have good data. But I have no doubt that as interest grows in the dietary supplement field, research is going to grow too. There are just pitfalls that we do have to make sure that we're aware of as we're using dietary supplements as they exist currently. So let's go over a few common supplements in headache. We don't, have time to go through all of these in detail, but I do want you to be aware of a few of them. So like I mentioned, butterbur, there is a branded dietary supplement product called Pitadalex. It has done the best research, so has the best data in support of its use, and it may help to prevent migraines. The dose specifically that's been used is 75 milligrams twice daily. The biggest safety concern is the presence of that liver toxicity. So some butterbur products contain these alkaloids that are toxic to the liver. You need to make sure that you have a product that is certified to be PA-free, so these pyrrolizidine alkaloid free. And Pitadalex, if we are going to recommend butterbur as a supplement, is what we're generally going to recommend because they are certified to be free of this. And just because it has it on the label that it's free of it doesn't mean it's actually free. It's really important to find something that's certified in the case of something that can be so toxic. Feverfew is another supplement that's available, and it may reduce the frequency of migraines as well as reduce the pain, nausea, vomiting, and light and sound sensitivity during a migraine. Now, of course, a dietary supplement study is different than a prescription medication study, but it may help in these scenarios. The dose that we see here for feverfew is 50 to 150 milligrams daily. But feverfew may have drug interactions with common medications. And that's because it does have interference with how drugs are broken down in the system. So it's important to make sure you're checking with your provider before you really start any dietary supplement, but especially ones that can have drug interactions. Magnesium and riboflavin, you may notice, are in a regular multivitamin. They're very common, and they're, in our diet normally, versus the butterbur and the feverfew are herbs that are not in our normal diet. Extra supplements of magnesium may be used for both acute migraine attacks as well as prevention of migraine. Initially, we're looking at 400 milligrams daily for migraine prevention. You do want to just start low on the magnesium. Magnesium, citrate and milk of magnesia are over-the-counter products that you might recognize for treating constipation. So taking too much extra magnesium can definitely contribute to diarrhea and gastrointestinal issues. So you don't want to overdo it. And you also, if you have any kidney issues, want to avoid taking any extra magnesium as well. So even in something like benign that we have in our food all the time, that's in your daily multivitamin, overdoing it as a supplement can still cause a lot of issues. Riboflavin is another name for vitamin B2. It has a little bit of conflicting data that may be helpful just for migraine prevention. And you would start again with the same dose of 400 milligrams daily. Riboflavin is generally well tolerated. And so that's a good one to maybe start with after a discussion with your provider. Coenzyme Q10 is possibly effective at migraine prevention as well, with a dose of 100 to 150 milligrams daily. CoQ10 has been studied in a lot of different things with varying levels of evidence for those uses, but it is generally well tolerated and can be added to most people's regimens if they are interested in trying a supplement. There are many more supplements that have been studied in migraine. Those are the ones that if patients express interest in a dietary supplement, those are ones that we kind of go to first. But certainly there are a lot of other supplements that people have found and that people may want to try. Specifically, a lot of people want to try cannabis, and so we'll just go over briefly some things about cannabis and headache. There are a lot of claims about cannabis and headache. So here in Utah, if you do have chronic pain, you may qualify for medical marijuana. It's not something that we are generally recommending at this time because there's no consensus in the data. There are a lot of claims about cannabis, but hardly any well-done studies. Most studies are really low quality. It's hard to find studies that are studying the exact same product of cannabis. And so we're just really unable to accurately assess what cannabis does, positive or negative, right now in migraine patients. And with regard to dosing, we don't have a way to recommend a specific dose to you right now. The product can vary greatly, even among dispensaries here in Utah or around the country or the world. They can carry medical grade marijuana, but it may be different versus place to place. The percent makeup of the product in terms of how much THC versus CBD component is present is not regulated right now. There are really limitless combinations of THC and CBD, and how they're made at the grower site is going to be different. And there's a lot of variation in the components. So we can't determine dosing. We can't provide reliable recommendations. We can't provide recommendations that that we're positive will be safe. And so we're still waiting on some studies right now. So that's why we're not recommending it like we do some of these other products. There are also safety concerns that we have. Marijuana presents drug interaction potential. So we can draw from a medication that's currently FDA approved called Epidiolex. It's for seizures in children. And because that has the rigorous studies required by the FDA, we know what that product interacts with, and it has a fair number of drug interactions. And so we need to extrapolate that and think that most strains, if not all, will also have the same drug interactions. Side effects can vary based on the formulation. Like if you're having an edible form of cannabis versus if you're smoking marijuana, and that ratio, that amount of THC to CBD, it's making it impossible for us to predict any specific person's response at this time. There's also recent literature from the American Academy of Neurology meeting just a couple months ago that use of cannabis may contribute to medication overuse headache, which we certainly don't want to recommend for patients. So we need to gather more data on that as well. So if I had one bottom line for you guys before I open it up to any discussion, if you are considering use of a supplement, definitely involve us just so we can run interaction checks and let you know what to look out for before you start the product. And so with that, I will take any questions or if anyone has any